Hi everyone, I want to talk about how the Stoics would have approached COVID-19. Stoicism is an ancient Greco-Roman philosophy that I'm a huge fan of. One of the key pillars is the advice to always take a step back from one's emotions and think logically and calmly about any problems we face. I've spoken before about how modern day society is pretty much the complete opposite of a Stoic society. Many different factors have come together to do this, but it's mainly been driven by both mainstream and social media over the last few years. A great deal of sensationalism, overreaction, and knee-jerk approaches have not only become the norm, but are also actively encouraged and rewarded in today's world. The biggest challenge the world has had to face, no doubt, over the last several months has been the spread of coronavirus. I am a practicing doctor in the United States and grew up in the United Kingdom. I've treated many COVID-19 patients at the front lines in the hospital, ranging from mildly unwell to being seriously ill. I've looked them in the eye and rooted for them the whole way. Thankfully, they've all got better and been discharged. I should also add that I've had COVID-19 myself a few months back. Let me start off by saying that COVID-19 has obviously caused a lot of suffering since it started, but thankfully appears to be a serious disease in only a small percentage of people. For the vast majority, it appears to be a mild illness where you can recover at home. On so many different levels, almost every country in the world has completely mismanaged the virus. A degree of that was understandable at the beginning when we didn't quite know what we were dealing with. But now, several months in, physicians and scientists do have a greater hold on the virus and how it operates. Sadly, our response has also become extremely politicized as well in the United States, which clouds the whole issue as people take partisan sides. That's completely unhelpful. At least as far as science goes, it's all about looking at data and conducting solid research. Along the way, having different theories, listening, and vigorously debating is to be encouraged. Sadly, though, what I've seen, even by some in the medical community, is wanting to almost silence anyone and shut down anyone who disagrees with them. That's not what science or a civilized society is about. You listen and then present facts to the best of your ability. I want to, for a few minutes, imagine how the ancient Stoics would be viewing COVID-19 if we take a step back and attempt a logical approach to where we are. While I would never claim to be able to get into the mind of a true great such as Seneca or Marcus Aurelius, I am going to try to be as rational, realistic, and truthful as possible here with this list. Number 1, is coronavirus containable? Let's think about this for a moment. The illness has already spread around the world like wildfire and has likely been doing so since the end of last year. We know that, like most respiratory viruses, a large degree of people are asymptomatic carriers. In fact, just like the flu, it's estimated that up to 80% of people have no symptoms whatsoever, not even a sneeze, i.e. their immune system has probably done its job and killed the virus immediately, stopping it from spreading within their bodies. They do probably continue to carry low levels of the virus for some time though. Remember, these asymptomatic people have not been included in the numbers you see on the news. With millions of people therefore already going undetected, logic would therefore dictate that COVID-19 is an illness that is impossible to contain unless you either keep everybody in lockdown indefinitely, test everybody on the planet every couple of weeks, and even if those trillions of dollars could be spent, the swab test will never be 100% sensitive anyway. No test we do in medicine ever is. We would still miss a lot of cases. What we do hope, though, is that out of those people who do have it and recover, most will be left with some degree of immunity. So, in answer to that question, no, COVID-19 is not an illness that can be contained and eliminated any more than the common flu can be. Any authority figure who is claiming this is either unfamiliar with the way respiratory viruses operate once they have spread, or worse, is lying. The best we can do is try to minimize risk and target the at-risk vulnerable groups. That's what the Stoic approach would be. Number 2, the media. Modern 24/7 news on our phones, which, think about it, we didn't even have 10 years ago, will always highlight the really bad cases and outliers. As tragic as they are, for every one of these very sad stories you get a news alert for, there are many, many more people who have recovered at home safely. The Stoic approach to the media would be to take a step back and understand this reality of news we receive being skewed towards the very bad cases. A lot of what we are reading and seeing on the news, especially in the corporate news industry, which relies on viewership and clicks, is no doubt sensationalized and encourages a great deal of hysteria. Do not be surprised or be thrown off when you hear about clusters of infection occurring, because these stories will be inevitable for years to come. Stoicism is all about perspective and looking at the entirety of the situation. COVID-19 is a respiratory virus, as I said, that is a mild respiratory illness in most people without significant risk factors. It is not the bubonic plague or a flesh-eating bug. Number 3, a vaccine. Many people are hanging their hats on a COVID-19 vaccine. Yes, we all hope for that. That would be great, but let's be rational here. When have we ever found a 100% effective vaccine for a respiratory virus? The flu vaccine, for example, is universally recommended. Millions of people have it, but we still see the flu everywhere with regional outbreaks. Viruses also mutate all the time, so a successful vaccine is that much more difficult. It may have a mild to moderate effect, but Stoics will realize that a vaccine will not be the end of the story. Number 4, getting the world moving. The sad reality is that coronavirus has got humanity in something of a trap. Start moving and resuming life again in 2 weeks, and it will start spreading in 2 weeks. Do it in 2 months, and it'll happen in 2 months. And 2 years, it'll be in 2 years, and so forth. So what can we do? We know we can't keep workplaces closed and schools shut forever. That will be even more devastating, especially schools. The Stoic approach would be to work on gradually resuming normal life and understanding, as Tony Blair, the former Prime Minister of the United Kingdom, recently said, coronavirus is something we are going to have to learn to live with. The idea of zero risk is impossible unless you isolate yourself alone at home for good. We know that of the people who do have symptoms, thankfully only a very small percentage are at risk of severe disease. And we know the 2 biggest risk factors, including the elderly and those with underlying medical conditions, make the disease so much more severe. Some estimates suggest that for children, there is more risk of being hit by lightning than of dying of coronavirus. The best we can do is take sensible common sense precautions and protect vulnerable groups. But we have to be realistic that economies are important and mass unemployment and poverty are also a huge problem. In fact, the United Nations has estimated that over 100 million people, mainly in poorer nations, could go hungry because of COVID-19. Number 5, other health consequences. I can tell you from personal experience as an internal medicine doctor that I have seen more patients with illnesses as a consequence of the lockdown over the last several weeks, including issues due to missed or cancelled appointments and procedures, depression, alcoholism, and even sadly overdoses than I have of patients who have actually had COVID-19. Lots and lots of doctors will tell you the same thing. That's the truth. The physical and mental health toll of lockdown and restrictions are astronomical. The Stoic approach, especially in healthcare, would be to identify and take care of all these problems and plow enough resources into combating them. We cannot lose focus of all the other killer diseases and mental health particularly. But some of the killer diseases would include heart disease, cancer, and diabetes. We can't plow resources away from all of these conditions during this pandemic. Number 6, what are we going to do when winter comes? Authorities everywhere in different countries are advising people to completely isolate if they develop any respiratory symptoms at all. We have to be rational here. Every other person in the winter has the sniffles and common colds, especially children. What on earth will we do when so many people start reporting these symptoms in a few months? How will the world work if we adopt this approach? And can we perform COVID tests on so many millions of people every week? And remember, all of these people with mild symptoms, thinking it was a cold previously, would previously just have worked on. Now they will have to be tested. The Stoics would be preparing for this onslaught and also planning practical solutions, including having healthcare capacity ready for if and when additional patients are hospitalized with COVID-19. Number 7, lifestyle. Stoicism is all about separating what's in our control from what's out of our control. We know that probably the third biggest risk factor for getting seriously ill from COVID-19 is being overweight or obese, and the tremendous strain that puts on your lungs and the likely pro-inflammatory, immunity-suppressing effects. It's actually a huge shame that the media has almost ignored this issue. And I'm also pretty ashamed, to be honest, that the medical community has had almost radio silence on this issue. Soaring obesity rates over the last few decades place us at a huge disadvantage in this fight. Imagine how much good would have been done if, beside every story on COVID-19 in the media, there was also gentle advice to eat healthier, exercise, and boost your own immune system. This is the one factor in our control, and we've seen that countries with very low rates of obesity and lifestyle-related diseases compared to the West, such as Japan, have suffered much less due to the virus. The Stoics would have relentlessly been pushing a healthy lifestyle from day one of this as something controllable. So there you go. Some thoughts on how the Stoics would have dealt with COVID-19. They probably would have been absolutely horrified with our collective response to this illness on so many different levels. Stoicism would be calling for a more calm, rational, and logical response, being realistic the whole way that elimination of the virus is not a realistic goal once it has spread, reminding people that thankfully only a very small percentage of people get seriously ill, targeting and protecting the at-risk and vulnerable groups such as the elderly and those with underlying diseases, not letting sensationalism, hysteria, or the media sail the ship, avoiding any knee-jerk or overreactions, and understanding that an indefinite lockdown or restrictions are not feasible, while focusing on what factors are in our control, including our lifestyles and how we can all take sensible, common sense precautions. People are not stupid and can be told the truth. I personally think this country's and the world's response and results would be a lot better if we were a lot more stoical. Thanks very much for listening. I hope you've enjoyed this video. Please do go ahead and subscribe for similar videos. I will see you next time.